So thank you all for joining this session. We are very lucky to have Varada and let me make Varada kind of a spotlight so that you will see her better. Okay. And then you can, if you want to share that, you can share that, Varada. Okay. So we are very lucky to have Varada to give us this session. And on the topic, which is very, very important to all of us, many of you practice the breathing, and she is the right person to tell us about, what are the benefits, how does it affect your lungs and so on. Yeah, I read her bio, and she has been practicing for a long time in Atlanta, and now she just retired. She has been, practicing more kids with any pulmonary issues. I may be wrong, something that I'm saying, Varada, I'm not sure. But
no, you are saying it right.
and so welcome, Varada, and welcome all of you. And Varada, you can take over.
Okay. Sure. I thank you for being there. This is a topic very close to me. Yes, I am a pediatric pulmonologist taken care of the kids with the lung problems. And my interest was mainly premature babies because they have means very vulnerable for breathing issues. Two things I must clarify for. I am used to teaching this to the young kids. So my language can be very basic. So not to offend all the knowledgeable people who are attending. I'm just going to break it down. And I feel like I understand more if I know why I'm doing, what am I supposed to do, and what it does to me. And with that concept, I'm looking at pranayam as a thing that helps us all. We just have to be mindful about it. And that is where I'm doing that. So I may go through my slides. The human body, we take it for granted, but it's a miraculous self-healing machine. But these self-repair systems do require some attention. We may be paying more attention to our cars. When they make noise, we take it to the mechanic or do the tune up regularly so it can function better. But we owe some more attention to our body. And that is a humble request. What we will learn today. I will explain to you how lung is a unique organ. Simplicity's sake, it's a balloon with pipes, each one with a special lining within and covering it. Then breathing, we have a voluntary, involuntary, as well as types like belly breathing, chest breathing, and the difference between the kids, infants, kids, and us, adults. Then we come down to pranayam. Pran is nothing but energy and oxygen. Ayam is to control, and totally voluntary effort that controls the phases of breathing and thus the air exchange and the benefits. And then we go through the phases of pranayam and how it benefits us. The routine techniques that we practice every day. Holding the breath in inhalation, exhalation, Kapalbhati, Agnisar, Ujjayi, Bhastrika, Anulom Vilom, gold nugget. I must say, Brahmari and Om, Dr. Mainil has done an excellent presentation on that, so I was not going to cover it on this talk. Stop me with your questions if you have any, or we can have a question answer session at the end.
So I would suggest that question answer, keep it at end, otherwise it is causes disturbance.
Okay, no problem.
If you have any questions, put them in the chat box.
Yeah, that would be nice. Let's talk about the lung. Why am I calling it the unique organ? All the organs are unique, but as a lung, where it is situated, that is one organ gets the whole blood supply from the body. Other organs get just a fraction. Because the lung does the job of getting fresh oxygen, oxygen carrying capacity and improve the tissue oxygenation and all that. Heart and lung work together. If you can look at the lung as a sieve and a heart as a pump that forces the blood through it, then we can understand how they work together. If the heart fails, there is water logging in the lungs. If the lung sieve, the openings become narrow for whatever reason, then the heart has to work harder. Essentially, as you can see, we start with the nose, upper airway, voice box, windpipe, the branches of the windpipe. The main windpipe, which is right there, what we need to understand is the final thing, what we call the alveolar sac. In adults, it divides 23 what we call generations. But when the baby is born, they have only 15 to 16 generations. So all that growth is after birth. And all the linings are special. The lining of the lung here is special. The lining on the top of the lung is special. The blood vessels have a special lining, and that's how it becomes more unique. They also have endocrine functions. Regulation of breathing, we can learn mainly from the babies, because when the baby is born, the mom has been doing the work of breathing for the baby. So it's like a child who's been on dialysis and taken off the dialysis. Then it has to function on its own. So very first 6 months at least, there are a rapid growth. The baby's trying to find out how much to breathe, how often, how deep, and all those kind of things. And I will go over the differences between that. But it all is done, voluntary part comes out from the higher brain, but majority of it is in the medulla, where the breathing center is. And the major organ or the nerve, that's the vagus nerve, supplies it all. We have the skeletal muscles, the rib cavity and the chest muscles. They are controlled by a higher brain, but all the other ones are autonomic nervous system. And there is a definite pattern. There is a center, what we call pneumotaxic center and apneustic center. Both are responding to the oxygen and carbon dioxide levels in the blood. What we need to understand is the phases of the breathing. As anything, it's like looking at a balloon with a pipe, that you are blowing up the balloon, and that's our inhalation, and you are letting it go, that's an exhalation. This is a closed system. Only opening is through the nose and the mouth. Rest of it is closed, so the pressure changes are directly affected. That's taken off when somebody has a tracheostomy or an opening here, then that closed system becomes open. Otherwise, it's a very closed system. If the diaphragm goes down, there is a vacuum. If the chest comes up, there is a vacuum, and the outside air will go in. And that is our inhalation. Of course, the muscles of the chest wall and the belly are also active in our breathing phases. In exhalation, as I mentioned, it's a passive process of letting go the balloon deflate. But when we are doing pranayam, both these phases are active and we have a control on them. So that is where it becomes. Now, key thing between the two is that chest is, the ribs are attached to the front here and the backbone at the back, and they expand like a bucket handle. But once the chest becomes fixed, there's no more to go. But if we breathe through the diaphragm, there is nothing holding us here. So we can take deeper breath or more air. The other thing to look at is that when we put the air in the balloon goes up. So when we take a deep breath, mainly the upper part of the chest, it gets the air, but the lower parts are not. And by using the diaphragm, you are increasing the breathing capacity.
Thank you, Shakshana. Love you.
Somebody's, can you unmute, please? The air pressures in the chest also act on the airway system. Our trachea has a cartilage which we can feel in the neck in the front, but at the back there is only a muscle. So in inspiration, it opens up widely, but breathing out, it can go down that way because there is a positive pressure and it collapses it. And the resting position is here. And those become important. If somebody has a back problem like a scoliosis or something, the airway system gets crooked, and then some part of the lung will get more air than the other. So there are a lot of things dependent on that. Gas exchange, I may not go into a whole lot, but important to know that the impure blood comes from all the tissues to the right side of the heart, then it goes to the lungs, gets oxygen, comes to the left side, and then it is distributed to all the organs. As I mentioned, lung is the only organ that gets the whole blood in the body. All the other are blood, fractionated amounts. Now, one thing we have to understand that the children are not small adults. There is a definite difference. Our specialty came after neonatology started creating the chronic lungers. And the people who were adult pulmonologists started doing things like they would do to the adults, and they were not able to ventilate the kids adequately. And that's where our specialization came. As I mentioned before, the respiratory center is very immature. Significant growth occurs in the first 3 years, and they are more sensitive to lack of oxygen. When we become adults or slightly from the school age on, we are more sensitive to carbon dioxide retention. When we come down to the chest cavity, the ribs are mainly soft cartilages. So the chest is very flappy and elastic in the babies, and the muscles are not mature. Breathing rate of the baby can be, normal baby can be in 30 to 40s in the first year, gradually decreasing by the school year in the 20s. Whereas in us, the rib are more bony, almost bony. There's not much cartilage there except where it attaches to the chest bone. It's much firmer, and the breathing rate goes down to 15 to 20 per minute. Heart and lung breathing rate and heart rate are closely associated. So anytime we increase the cycles of the breathing, thus reducing the number of the breaths, automatically the heart rate goes down. Now, muscles of breathing, there are plenty. They are all the rib cage muscles, back muscles, belly muscles, all of them. In the children, they are more oxygen dependent because what we call anaerobic metabolism, meaning thereby when there is no oxygen, how can we go? Or the runners and all the, or the high altitude people, how they breathe. Those things are not there in the kids. They come out much later. And adults, we can stand lack of oxygen a little longer. If we come down to the number of the balloons, the what we call alveoli, at birth, we have maybe around 50 million, but rapidly grow in the first year and then first 3 years, but no new ones are added after the age 8. And the cells are still differentiating. There are different types of cells, as I mentioned, what they do in the lung. There are also endocrine functions. Those are also differentiating. In an adult, we have much more reserve in the lungs. Actually, we have some notable singers who had taken one lung out, secondary to the TB and all that, and they were singing classical music. So we can live on one lung. We have a lot extra there, but we don't use it all. If we call alveolar surface where the air exchange happens actually, the surface is vast. It's 70 times our skin surface. So you can imagine it's all folded up within the chest cavity, like maybe 2 tennis courts or whatever the number you can imagine. I mentioned earlier airway system, that's a unique system. How hard it is for the air to go in and out depends upon the diameter of the airway or the radius of the air of the tube. In us, in adults, even if we have 23 generations, our trachea is about 1 to 1.5 inch at the root at the first generation. The alveolar sacs or the terminal bronchioles are less than 2 millimeters. So you go from 2.5 centimeters to 2 millimeters. And that happens to be only 10% of our airways. But when we go in the kids, in the newborns, those small airways are making almost 50 to 60% of the airway system. And then gradually, even then at a later age, by 3 years, it is still at 4 to 5 out of 10. So the air is having more trouble to flow through it. If we look at the posture, the babies are mainly lying down till they learn to sit up by age 6 to 8 months. Lying down, we are splinting our back, and that's the worst position we can be when it comes to breathing. And that's where they are. We, as we mature, are mainly erect, standing up, sitting up, and are better at breathing because all the contents in the belly are not pushing against the diaphragm, and diaphragm is free. Whereas in the babies, all the organs are just still pushing on the diaphragm, and the diaphragm is still their main muscle of breathing because the chest muscles are not very well developed, or the abdominal. Now, when it comes to the immune system, up to 6 months, mom's immunity gives a baby some protection, but they are still more vulnerable to the infections. In the adults, we may be mature, but we expose ourselves to high risk things like the tobacco smoke or other drugs, and also industrial gases, making us more vulnerable to their toxic effects and also causing the cancer, etc. Why am I going into details that much? Because when I see the class I attend, most of us are at the grandparent age and we may have grandkids, or we may be the parents of young ones. So it's a nice friendly reminder that the kids under 3, because of their immaturity and a very elastic but a resistant breathing system, are more vulnerable to the breathing problems. And not only that, they demand an urgent attention because they are very sensitive to lack of oxygen. Now let's go on to pranayam. As I mentioned, pran is energy or oxygen, and ayam is to control. It's a totally voluntary breathing that controls the phases of breathing and thus the air exchange. An excellent way it is called is our mind, which is like a wild horse, which has a full power and capacity, but is very hard or difficult to tame. And pranayam is the tool to train the mind. After all, our body is nothing but a robot that is controlled by our subconscious mind. So that is where we are making more impact. If we go through the phases of pranayam, in fact, when Shri does the anulom vilom, you may want to pay attention to that because we take a deep breath then followed by a hold the breath in inhalation, then a complete and deep, easy breathing out, and then the holding breath in exhalation. And these are the four phases of pranayam called Purak, Antarkumbhak, Rechak, and Baya Kumbhak. I started counting the numbers when he announces take a deep breath and all that. Usually he follows a ratio of 1, 1, 2, 1, meaning thereby inhalation is 1, maybe up to a count of 5 or 6, holding it for the same amount. But Rechak is almost twice the Purak, up to 10 or 12, and then holding the breath again for a count of 5 or 6. Isha Yoga, which I had attended their inner engineering and other things, they use different proportion targeting each major organ for the lung, for the heart, for the kidney, and all that. But I don't think we need to go into all those details because it is hard to keep in, remember all that. Now, how does pranayam help us? I think at least 3 minimum ways or the key mechanisms I can think about. One, definitely control over the mind. When we increase the timing of the inhalation and exhalation, breathing in and breathing out, we automatically decrease the breathing rate. Say count of 5 seconds or 6 seconds, then a count of 6 seconds, so that's 12 seconds, then a count of 12 seconds for breathing out, that's 24, and then a count of 6 seconds, that's 30. So if you really think about it, you're breathing only twice a minute. And that significant reduction in the respiratory rate comes down your heart rate also. It also calms down the mind and increases the focus and concentration. In the body, with the reduction in breathing, the heart also improves the circulation. Because one thing I forgot to mention, when there is a vacuum created in the inspiration, the blood supply from the body coming to the heart is increased. And when we are taking a longer time to breathe out, the air exchange is given a longer time. And also at the same time, the heart gets its own blood supply when it is relaxing. So that also improves. And as the circulation improves, oxygenation improves, and each cell of every organ start working optimally. And eventually a harmonious and efficient functioning of all the body system happens. Another thing we need to pay attention is that there are pressure changes. There are pressure changes in the chest and there are pressure changes in the abdomen. Pressure changes in the chest, I mentioned what happens to the lungs as well as the heart. And there are big vessels, so they all go through that. But then there is a lymphatic system that also the drainage improves. It comes back in the chest cavity more. When we use the vibrational techniques like Brahmari and Om and those, that also causes further improvement of our organs by stimulating the nerve endings and also creating new synapses, what we call neuroplasticity, which Dr. Mainil had expressed in his talk. In the abdomen, the pressure changes are opposite to the chest. When the chest is creating vacuum, the belly gets more positive pressure. And when the chest is breathing out or when we empty out, pulling the diaphragm up, there is a negative pressure. And these pressure changes in the abdomen, where there are more organs lying, improve the functioning of it. The peristalsis or the contraction of the smooth muscles of the intestine, ureter, all the organs there improves further. So those are the three main mechanism I would say help us. Now, one thing is there, we do something called a gold nugget, or Shri does mention that hold the breath up to 10 or 20, you can, wherever you can, because that is something we really have to gradually increase. If we hold the breath in exhalation, the a proportion of the carbon dioxide can increase. And that can be harmful to the people with the lung problems as well as the heart problems. So each one has to gradually improve that duration. Again, it's like the wild animals being tamed with very gradual training. Not to give up, but stay in and gradually increase the phases. Now, what happens during the techniques we do every day? By nature, I am tending to observe people's breathing. Knowingly, unknowingly, I observe. Some of us are still using the chest cavity to breathe, not using our belly muscles, may not be sitting up totally erect. So our posture is not proper and thus limits how far our lung can expand. As I mentioned, chest wall is mobile, but it has limitation. Once we expand it completely, it cannot push air into the lungs, and the more lung capacity is improved by using the diaphragms. So belly breathing is much more efficient and better. It also calms down. In my practice, I used to see a lot of elite athletes and high performance who will have performance anxiety. And those will be coming in with the complaint, I can't breathe. But when we do the breathing test, pulmonary function test, they will be totally normal or in fact above normal, like 110 to 120% of predicted. At that time, I do have to sit down and tell them, because not being able to breathe is a feeling and anxiety can cause that. And when we are anxious, we are kind of prone to use thoracic breathing and the chest cavity becomes fixed and we can't get any more air. And that's where they need to learn the relaxation techniques. And the easiest one is to change to belly breathing than the chest breathing. Belly breathing, because they are elite athletes, their fat content is very minimum in the body, and the bellies are usually flat. So there is nothing holding against the diaphragm. And they really see the difference right there. I have taught belly breathing as well as Anulom Vilom, not only to the elite athletes, but kids with asthma from age 4 on. If the child is of the right mindset and listens well, you can start training them that early and they do understand, but we just have to break it down to their level. Deep inhalation, as I mentioned, causes a negative pressure in the chest, causing a better venous blood coming to the heart along with the also lymphatics. The alveoli of the breathing apparatus in the lung are better inflated. Holding it longer allows more time for the gas exchange, improving the tissue oxygenation. Simultaneously, as I mentioned, there is a positive pressure in the abdomen. Blood supply to the spleen, liver, kidneys, pancreas, all of them improves and helps to build the pressure and elimination in the large intestine as well as urinary bladder. Holding breath in exhalation. Complete exhalation empties the lung, giving more room to the heart. Heart is able to get blood supply and hence nutrients. And alveoli are emptied, so amount of available oxygen is low, but carbon dioxide continues to rise. The diaphragm gets up in the chest increasing the pressure in the chest, but reducing the pressure in the abdomen. As I mentioned below earlier, we have to increase that gradually and as tolerated with the people having heart and lung issues. Now, Kapalbhati, right? Kapal is our forehead and Bhati is to shine. And the main force is in on forceful exhalation. We raise our interlocked hands above the head, which raises and fully expands the rib cage and fills the upper part of the lungs better. But the forceful contraction of the diaphragm empties the lungs with a speed, helping clearing the airways, nasal passages, and the sinuses of the phlegm, dust, or whatever else is there. Of course, improves the gas exchange, giving more energy. Inhalation, we don't have to think because it's a pressure change and a closed cavity. So automatically it becomes automatic and gets filled up. Pressure changes in the chest are rapid. So that's where the people with the high blood pressure and heart disease have to increase the time they spend in Kapalbhati gradually. Agnisar. Agni is fire. Here it's mainly gastric and intestinal juices, and Sar is the extract. After completely exhaling, the abdominal muscles are contracted and then expanded fully, repeating the process rapidly. The positive and negative pressures in the abdomen change with the swift movement made during the process and act directly on the internal organs, improving their blood circulation, nutrients unloaded, and toxins are removed. Digestion is improved with the stomach and intestine and liver function. The efficiency of the pancreas increases, more insulin is produced, and the sugar is digested properly. So that is very helpful in the people with diabetes. Ujjayi. It's a both ud meaning more or higher, and jay is a breath or victory. So it's like a victorious breath. We also do that with the small or the voice box constricted or narrowed. So it sounds like a hissing sound that is called, so it's also known as cobra breath or ocean breath. It's a deep, slow inhalation, filling the lower lungs first, moving upwards, held in inhalation, and then emptying gradually through the constricted vocal cords, producing the hissing sound. Usually taking twice the inhalation time. Increasing each phase of breathing increases the breathing capacity. Heart gets rest and better blood supply as the exhalation is prolonged, better oxygen exchange as the inhalation is deep and exhalation is prolonged. It regulates the body's internal heat and helps to control the blood pressure, releases tension, and also strengthens the digestive and nervous system. Bhastrika. Bhastrika is like the bellows used by the blacksmith to melt the metals. Inhalation and exhalation repeatedly, deeply and thoroughly, using the diaphragms and exhaling through the mouth or the nose. Preferred the nose, but also can be used in the mouth. Surges the flow of the air into the body to produce the heat at both physical and subtle level, stoking the inner fire of the mind and the body. When done regularly, removes blockages from the nose and chest. It's also suitable for asthmatic patients and removes the inflammation from the throat. Increases the gastric fire, improves appetite and digestion capacity. When practiced with Kumbhaka, it can generate heat in the body and keep it warm in the rainy and cold weather. Anulom Vilom. This is my favorite one because that's a simple one to teach the people and has a vast effect because we have something called the autonomic nervous system, which mainly supplies all the organs in the body. We have parasympathetic, that is our left nostril, and sympathetic, which is our right nostril. And they really, whether we are afraid, that is causing the sympathetic response, adrenaline, and we get fearful or get tension or blood pressure rises, all those are effects of the sympathetic system. And parasympathetic is just opposite of that. Anulom is in a natural order or direction, and Vilom is produced in the reverse order. So all we are doing is breathing from the alternate nostril, and we are, as we start, we use the left nostril first, breathe in and breathe out through that, then go to the right nostril, breathe in and breathe out through that, and then we start exchanging it. So all we are doing is helping the sympathetic and parasympathetic system kind of getting started to get tuned up. It really helps not only the common conditions like asthma, acidity, allergic problems, snoring, and constipation, but also serious health disorders like the heart problems, severe depression, high blood pressure, migraine headaches, and arthritis also. They all seem to get better. By that is mainly because of the balanced autonomic nervous system. The negativity is gone, so the thinking becomes more positive, and you can overcome the negative emotions such as the anger, forgetfulness, uneasiness, frustrations, and all that. Our concentration, patience, focus, decision making ability, and the creativity increases. It balances all the three doshas described in Ayurveda. I cannot brag about this simple technique which has such a vast effect. Even if somebody doesn't do anything else, if they do abdominal breathing and do Anulom Vilom on a regular basis, they can see the improvement within themselves. Gold nugget is something I learned in this class for the first time, and I had to read up and find out about it. And it is a gold nugget because it's a very beautiful exercise establishing connections between all the parts of our body actually and the mind, subtle, mental, emotional, physical body, and the brain system. And I was really zapped to read about it, how it does all that. And I am not an authority on it, but what I learned is physically when the certain muscles are contracted, nerve impulses are relayed to the brain, triggering the other neuronal circuits and the nerve centers, which affect our state of consciousness. Holding the breath for 40 seconds after a complete exhalation, plus the pulling in the abdomen, like the bandhavi put, and keeping the pressure and pulling contraction constantly during the course of the exercise activates the parasympathetic system at the maximum. And the result of this is a complete calming of the body and brain system. That is kind of studied and documented. So if we look at it on the physical level, the heart rate goes down, blood pressure decreases, the digestive system is toned, and the entire muscle structure is relaxed. On the emotional level, the activation of the parasympathetic system and the perineal pressure. Subtle changes occur in the brain, pituitary, and pineal glands, as well as hypothalamus, that regulate the entire endocrine system, creating an emotional and hormonal stability. On the mental level, via there is a nerve called pudendal nerve, manages the endocrines, and plus with the spine, the chakras, the constant tension in the due course of time. Reactivation of this area helps in clearing the pathways, or in other words, helps all the cross, incorrect, confused circuits in the brain. So it's a really tune up, getting rid of all the negative emotions and the incorrect thinking and retraining the brain. At the subtle level, there is a correction in the movement of the chakras, which lead to the total communication between them, and all the blocks are removed. And that is where you feel the change after that. As I mentioned before, Brahmari and Om, I'm not going to address because Dr. Mainia has done a wonderful job on giving almost an hour sessions on both of them. So that is where I would stop. Thank you again.
Thank you very much, Varda, for the wonderful session. And I'm sure there will be lots of questions, not just today, but as people practice it, they will be asking more questions.